When parents bring babies to craniosacral therapists, there's usually something specific that they want to address, and often it's anatomical. It's torticollis or an interesting head shape, or we're having a feeding difficulty. And so they're hoping that the therapist will have some sort of biomechanical way of fixing it. Um, and in this class, we really approach all the different layers of it. So we'll approach the anatomy, but we're also going to approach the experience of how the anatomy is holding this shape and why. And all of that is happening within a relational field, especially feeding difficulties. That's something that is happening in relationship with mom. And even if the difficulty is anatomical, there's something shared about that.
So there's something in the relational field that you could address that would support the anatomy?
Exactly. And as we know with working with adults, it's in that relational field of trust that the anatomy softens and relaxes and can reorganize.
Mm, mhm.
And when
So
we're
it's,
working with babies, it's not just holding that safety for baby, but for the care providers as well. And postpartum is such a delicate time. I mean, parents have a lot of feelings and emotions and their own challenges rising to being a new parent.
I've noticed in my work that new parents often feel that they can't have their feelings in front of their children. Do you see that?
I do see that. That's such a tender place because that's compartmentalizing a part of yourself that your baby is already aware of and really needs the reassurance that you're both having an emotional experience.
Yeah, that it's helpful to know that both people are being challenged, not just one.
Mhm. Sometimes our role in those situations is to start the conversation.
Yeah.
And so we'll be learning some of those skills as well. How do you know where to begin?
Mm.
How do you ask those questions?